I'd like to thank the organizers for the opportunity to present this study at this meeting and my co-authors, Dr. Sohen Heirei and Dr. Duya Hashimoto. These are my financial disclosures, which do not relate to the topic of this talk. The take-home points for this talk is that in human eyes, choroidal hypoperfusion zones are present in every eye and usually involve either a portion or the entire optic nerve head. Blood flow is significantly reduced in choroidal hypoperfusion zones, especially during diastole, and show a reduced pulsatility. Now, this may be very important in nonarteritic ischemic optic neuropathy, glaucoma, diabetic ischemic maculopathy, and macular degeneration. There is also a high correlation between blood flow in the peripapillary choroid and the optic nerve rim tissue, which is supplied by the same vascular supply, making it susceptible to nocturnal hypotension. Here's an example of a patient with acute nonarteritic ischemic optic neuropathy of the left eye, and I'm showing a color fundus photo in an adjacent fluorescein angiogram from the early phase, showing this area of choroidal hypoperfusion involving the optic nerve head. And you can see the superimposed laser speckle blood flow showing in blue the area of decreased blood flow in the hypoperfusion zone, which is even more prominent during diastole. Dr. Heirei has written about choroidal hypoperfusion zones and watershed zones, and this is excerpted from his book on ischemic optic neuropathies, showing different examples on fluorescein angiography in the early phase of decreased filling, including part of the optic nerve is shown here, or all of the optic nerve is shown here. And the analogy is a sprinkler system in a lawn, that if you had multiple sprinklers and you turn down the water pressure, there are areas in between that get reduced sprinkled water, similar to blood flow. And here are examples in different eyes showing where the watershed zone might be located due to the development of the vasculature in different species and in different eyes, showing involving the macula or involving part or all of the optic nerve. And the shape of the watershed zone might be linear if there's just two major posterior ciliary arteries, or it may be shaped like this if there's three posterior ciliary arteries. This is a video examples from the fluorescein angiogram showing these areas of choroidal hypoperfusion in the early phase. It's quite striking. They eventually fill normal eyes, but the filling is slow compared to the rest of the cornea. In this example, this is a patient with glaucoma who had a choroidal hypoperfusion zone, including all of the optic nerve head. Adjacent to the fluorescein, you can see the laser speckle blood flow during the cardiac cycle. And you can imagine that a patient like this who experiences drops in blood pressure during sleep or nocturnal hypotension could suffer significant ischemia to the optic nerve head, especially when diastolic blood pressures fall below 50 millimeters of mercury. This is just 6 examples of the average blood flow using laser speckle flowography in 6 patients with acute nonarteritic aion, you can see the blue or low blood flow area involves all of the optic nerve head. Here's many eyes in normals showing the same thing. So these hypoperfusion zones are present in both diseased eyes and normal eyes and may provide a risk for ischemia, providing if the blood flow drops or the blood pressure drops below a certain range. We also studied the waveform both within the hypoperfusion zones shown here and in the same eye recorded simultaneously outside of the hypoperfusion zone. And you can see there's a much reduced amplitude of blood flow during the cardiac cycle and reduced blood flow, especially during diastole, compared to areas outside of the hypoperfusion zones. Some of these hypoperfusion zones involve a part of the optic nerve, shown here involving the temporal part of the nerve head, whereas other eyes show the zones including all of the optic nerve head. Here are some examples of an eye showing a hypoperfusion zone in the choroid in the early phase of the fluorescein angiogram. And Dr. Hashimoto constructed a montage of multiple laser speckle blood flow measurements merged together, showing a large area of choroidal hypoperfusion that's especially prominent during diastole compared to systole. So you can imagine during diastole, there can be profound decrease in blood flow in these areas of hypoperfusion, which include the prelaminar and laminar portion of the optic nerve head. Here's an example of a choroidal hypoperfusion zone only involving a smaller area, including just the temporal portion of the optic nerve head, as shown on both the fluorescein angiogram and the montage of laser speckle blood flow. This is a graph showing the blood flow in the peripapillary retina, peripapillary choroid, compared to the adjacent rim tissue in each of these 8 sectors surrounding the optic nerve head in NAION eyes and the fellow unaffected eye. And you can see that it's a very high correlation between blood flow in the rim tissue and the adjacent peripapillary choroid. And this correlation is of the order of 0.7 to 0.8 correlation coefficient, and is even present a high correlation in normal eyes. And you can see from these diagrams that the peripapillary choroid, supplied by branches of the posterior ciliary artery, also share a blood supply with the prelaminar and laminar tissue. So what's happening in these areas of hypoperfusion adjacent to the nerve also is present in the prelaminar and laminar portions. So that reduced blood flow in these areas also coincides with reduced blood flow in the rim tissue in these areas. So in summary, using laser speckle blood flow, we can define easily choroidal hypoperfusion zones. In human eyes, choroidal hypoperfusion zones are present in every eye and usually involve either a portion or the entire optic nerve head. Blood flow is significantly reduced in choroidal hypoperfusion zones, especially during diastole, and shows a reduced pulsatility. And these choroidal hypoperfusion zones and the reduced blood flow may be very important as risk factors in nonarteritic ischemic optic neuropathy, glaucoma, diabetic ischemic maculopathy, and macular degeneration, particularly during sleep when nocturnal hypotension can play an important role. We found a very high correlation between blood flow in the peripapillary choroid and the adjacent optic nerve rim tissue, which is supplied by the same vascular supply, making it susceptible to nocturnal hypotension. Thank you.